You're watching Capital Connection from the Illinois State Capitol.
Welcome back. So far, it's been a pretty slow start to the 2024 spring legislative session, but in just a week and a half, Governor Pritzker is going to give his annual budget address and really kick things off for the rest of the spring. Joining us now is Senate Minority Leader John Curran. Thank you so much for joining us.
Cole, real nice to be with you.
So one of the biggest topics that's really weighing over this year's budget is how much the state might kick in on the migrant crisis in Chicago to try to maybe shelter or just how they're going to help the city manage this and potentially more of the state manage this issue. You recently had an op-ed talking about this, but how do you feel the state should navigate this financially when it comes to this year's budget?
Cole, budget is a list of priorities. The governor, in his time, has prioritized the non-citizen community, and in his 6 years in office, that has gone from a $1 million a year annual spend to over $1 billion a year spent in that category. The governor has definitely placed that at the top of the priority list, ahead of Illinois residents. That's where the course correction needs to happen. The governor needs to course correct back to prioritizing the residents of Illinois and their needs throughout the services that the state provides in this budget address. I hope that's what we hear from the governor is a course correction. Is
that too little too late though at that point? Because if we're talking about cutting back spending, these are people that are here. There was a drop in the migrant population in Chicago from the asylum seekers in the past couple of weeks. But when we talk about the people that are here, the people that have been brought to Illinois, it's just leaving them with no potential services. Doesn't that make just the problem worse in that regard?
Cole, the people that want to come to Illinois because of our free, non-citizen welfare policies that are in place. So those policies need to be rolled back. With that, the demand will diminish. But we're talking, I pay for health care, you pay for health care. A free health care program that doesn't really have any meaningful co-pays, nothing to help manage the cost that Illinois taxpayers are stuck with the bill, that is a misplaced priority of this governor. And that's really an area that we can see some significant savings if he course corrects.
You don't think the new co-pays that were just instituted are enough on this particular, on the immigrant health?
They're going to amount to very little, if any, savings, Cole.
Got it. So when we're talking about this, though, you mentioned people want to come to Illinois for these policies. That was there was a part of that when those were getting passed. It was making Illinois a welcoming state for immigrants. But the migrant crisis in Chicago are people that are getting bused to Chicago. These are people that are crossing the border in Texas. They're claiming asylum, and then they're getting on a bus to the city at the direction of the Texas government. I mean, is that not a different? Are we not talking about two different groups of people here?
Cole, they're also coming from New York after they've been shipped to New York because they want to come to Illinois, and they're coming from Colorado. It is not just a red state to blue state issue. It is blue states also providing transportation here because we are truly an outlier. The governor proudly proclaimed his first year in office that he wanted to make Illinois the most welcoming state in the nation. He has done that, and we are now seeing the effects in the budget, quite frankly, the budget disaster that comes along with that without having balance to that approach and without getting the priorities of the state and the spending in the budget out of whack like he has done. That's why we really need to see a course correction from the governor in this upcoming year, or there's going to be no fix to this crisis.
With the budget this year, you've talked about reprioritizing. What priorities do you feel like are falling to the wayside because of this? Or is this just about spending less money in the budget?
DCFS, we have been in a consent decree for 33 years. The governor has had 6 years to address this crisis. We're talking about abused and neglected children that are in the charge of the state, the care of the state, and we consistently cannot provide the level of services required in that area. And that's a budgetary issue. We have to invest, yes, we have to invest in more mental health service providers. That is a huge deficit there. We have to invest in appropriate placements for these children. We have not grown that network. That's a budgetary item. When we talk about the developmental disabled community, it is with one hand and they're trying to take away from the other. Another consent decree, another area where Illinois has historically failed a community, the most vulnerable community, I would argue in this state. We are 49th out of 50th in the country in providing services to the developmentally disabled, investing in that. Why are we first in services to non-citizens, people that actually were not residents living here, paying taxes here, but we are 49th out of 50th for our own most vulnerable population in this state. These are the priorities we want to talk about, and we want to get the governor to course correct and focused appropriately.
On the topic of developmentally disabled care in the state, the DHS recently just changed course on a topic. There was going to be cuts at the start of April to the number of hours that were provided wholesale from the state. Now there's new meetings talking. They delayed it till the end of the fiscal year, and now they're talking about potentially just changing the formula on how the hours are dispersed with no actual cuts. Just your reaction to that on how that course was kind of changed and what it took to get there.
This is an example of the governor with his excessive spending authority. He is able to move more money around in the budget than any governor previously in this state. Really trying to claw dollars and cutting quietly from other places and other services provided to Illinois residents to pay for this growing migrant crisis. This was ill-placed. I would say our caucus pushed back hard. So did legislative Democrats. This was bipartisan pushback on the administration's misplaced priorities. We're thrilled that they reversed themselves. They have put that into the upcoming budget year. I want to hear from the governor in the upcoming budget address a guarantee that he's going to continue to invest and grow services for developmentally disabled community and is not going to try to take from them to pay for his most welcoming state policies and his attempt to get on the national stage and grow his national profile.
So overall, when we're talking about the budget address, when it comes to a lot of these, you want to see a total scaling back of that health insurance plan, a benefit now that has been offered that people are benefiting from. That would just be stripped in this particular in your idea.
Pull it back. This population should not be paying less or paying nothing for health care. And the residents of Illinois are paying co-pays, they're in managed care. They should not be getting better than the residents of the state who are the taxpayers paying for that program. Absolutely. We voted against it every time it's come up at each and every expansion. We argued Illinois can't afford this. This is a misplaced priority. And quite frankly, I think the governor has shown he can't manage it either.
Last year, when it came down to voting for the budget, there was actually, for the first time in a long time, a discussion on if Republican votes would be placed on the budget. And I wonder, just as we're starting off in this session, do you feel like that same attitude, that same approach is there to start off the year in the Senate?
I think we can get to that point. We want to make sure the areas of the state we represent and the priorities we represent are in that budget. And we're anxious to get to the table. The Senate Democrats were very good to work with last year in that process. We were very close. I wish it had landed, but it didn't. But a casual observation, Cole, when there was all this COVID money, and that was the most money spent in the history of this state. That was the largest budget in the history of the state. They didn't really need us. As we're going to hit more fiscal constraint, and right now we're looking at a deficit, I think there's more of a role for Republicans to come in. And maybe we're going to shift a little more to where the Democrats, even with their supermajorities, actually need us to get that budget over the finish line. So I'm excited about it. We're going to be anxious to get to the table, represent our districts, represent the priorities that have placed us here in the General Assembly. And I think a budget that involves Republicans is a more balanced product and truly represents the priorities of the state as a whole, rather than just the hyper focus on the left.
All right, well, Leader Curran, thank you so much for joining us.
Cool, very nice to be with you.
We'll be right back.